Bismillah ar-Rahman ar-Rahim. My dear candidate for MRCS, my name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon and one of the examiner in the Royal College of Surgeons of England. Believe me, we all as an examiner would like you to pass the MRCS exam. We really feel happy when we are joined by a young surgeon eager to get his high qualification in the field of surgery. And we are always helpful. And that is why I'm aiming to give a short videos about common mistakes. I usually examine 3 times in Egypt, in Maadi Hospital, and I also examine around once or twice a year in England, either London or Sheffield or Newcastle. And there are common mistakes for each country. There are common mistakes for Egyptian candidates, and there are common mistakes for MRCS candidates. I would like to concentrate on the common mistakes, which comes like a pattern. Because when I examine for 3 days in the Egyptian MRCS exam in Cairo, uh, I usually examine around 120 candidates. So there is a tendency toward very common mistakes. So let us speak today about the use of tuning fork. Tuning fork is one of the tools that we provide when we are aiming for you to do cranial nerve examination, to do Rene and Weber tests, and also for diabetic foot examination to examine a lower limb of a diabetic patient. A lot of you, let me say around 50%, does not know how to hold a tuning fork or to use it. So number one, the tuning fork we provide for you in the exam is much better than this one. There is a stand for it to stand on it, and there is a piece that you can hold it off. So when you are doing the tuning fork, you need it to create vibration, and you can do that by just putting your finger like this. That's it. But I've noticed people are trying to hit the chair or hit the bed of the patient. They hit it like this. Some people hit the wall. Some people hit their shoes. And some people, I remember one candidate, he had a fracture of his radius, so he had plate and screws, and he usually used the tuning fork by hitting his screw for the fracture of his radius. So the best way to create vibration just to do this, nothing more. And we provide for you this station that you need not to hold it from here because the vibration will go, but there is a small circle here that you hold it from, and this does not prevent the vibration. And then there is a touching pad at the end that you put it on the bony landmark of the foot to test for vibration. So all what you need to do is to vibrate it, hold it from here, not from the vibrating tuning fork, and put it on the bony landmark in the foot, like the medial malleolus, like the chin of the tibia, and so on. 50% does not know how to use a tuning fork. And this doesn't look very good because we have a professional degree to give you for how professional you have performed your examination. If you're unable to use a tuning fork, and we know that you want to be qualified as a surgeon, not as a physician, but you must know how to use a tuning fork. It's a very common mistake. You probably are using a stethoscope good, but for a tuning fork, there is a problem. So please watch the video of how to use a tuning fork. Secondly, for testing sensation, we don't use pin prick anymore because it is unhuman to get an actor and to get him pin prick 20 times in the morning and 20 times in the evening. So what we provide is a cotton wool and the monofilament. Probably a lot of candidates have not seen monofilament before and definitely have not used it. So we give you monofilament set, which is selected for one type of monofilament with a pin and cotton wool. This is an easy station to pass. Please concentrate on this very common mistake, how to use a tuning fork. not to hit it in the wall, not to hit it on the chair, not to hit it on your shoes, and not to hit it on your arm. Please, just to do just like this. Hold it where the vibration doesn't go and make the flat pad touch the area that you want to test the vibration on. So I wish you all the best, and I wish all of you pass MRCS exam Part B first shot. My name is Dr. Muhammad Omar Farouk. I'm a consultant vascular surgeon. I wish you all the best.